This is a review video over the male reproductive system. So again, just like the female reproductive system, everything starts in the hypothalamus with GnRH, so gonadotropin releasing hormone. This is going to spike during puberty. So gonadotropin releasing hormone releases gonadotropes from the anterior pituitary. So this is a 2-for-1 deal. So you get FSH, which is follicle stimulating hormone, and LH, which is luteinizing hormone. Those are your two gonadotropes. So follicle stimulating hormone is mostly going to stimulate the Sertoli cells, which are cells in the seminiferous tubules in the testicles, to produce spermatocytes or sperm cells. And then LH is going to stimulate cells called interstitial cells or Leydig cells to produce testosterone, an androgenic hormone. So again, we see the testicles there. So they're the male gonads. So the spermatic cord suspends them. And in the spermatic cord, we have the testicular artery, testicular veins, as well as the vas deferens, which is taking sperm from the epididymis into the body for ejaculation. So inside the testicles, we see seminiferous tubules, these little coiled tubes, and that's where we have these cells surrounding the tubules called Sertoli cells that make the spermatocytes, and they mature there, and then they're stored in the epididymis. The Leydig cells are interstitial cells because they're between the Sertoli cells, basically, and they make testosterone. Okay, so two problems we can see there. So we talked about these in class. We talked about testicular torsion. So if there's any kinking or twisting of the spermatic cord, we cut off testicular artery. So there's no oxygenated blood getting to the testicle. So this is a surgical emergency. And then variceles, which are very common. We have dilated testicular veins, like varicose veins, the testicles, right? And these can be like a bag of worms feeling on exam. And if they're bad enough when someone stands up, you can see them protruding from the scrotum. All right, so back to spermatocytes. So again, Sertoli cells make spermatocytes when stimulated by follicle stimulating hormone, and Leydig cells make testosterone. Okay, so testosterone. So testosterone then can be converted into two different hormones, right? So males need a certain amount of testosterone, and then they also need a certain amount of estrogen and another hormone called dihydrotestosterone or DHT. So testosterone is converted to estrogen via the aromatase enzyme. We saw this in females where the theca cells make androstenedione, and it needs converted to estrogen by the aromatase enzyme in granulosa cells, which are nearby. So here men need a certain amount of estrogen. It's the same enzyme called aromatase. Now men have this other hormone called DHT. So this is converted from testosterone by an enzyme called 5-alpha reductase. So 5-alpha reductase is another enzyme, again, it ends in ASE, that's converting testosterone to this other hormone. So DHT is more responsible for stimulation of secondary sex characteristics in males, like facial hair growth, the deepening of the voice and the vocal cords. This binds to receptors on the hair follicles and can lead to androgenic alopecia. It also binds to receptors in the prostate. So high levels of DHT could promote benign prostatic hyperplasia, so growth of the prostate. So we could see that through DHT. DHT also binds to receptors in the penis and is important for erection. So testosterone itself, again, is important for increased muscle mass production, some other male functions. Estrogen is important because it's osteoprotective, it's cardioprotective, it binds to receptors in the brain. It's important for sex drive and libido, all those very important functions. And remember, going way, way back, the hypothalamus is part of the limbic system. The 4 F's of the limbic system are fighting, fleeing, feeding, and reproduction, right? So remember, GnRH is produced by the hypothalamus. It's overseeing sex hormone production, and sex hormones are important for reproductive behavior. That's going way back. Okay, so, and what can block 5-alpha reductase? So we talk about some drugs. So finasteride and dutasteride, they're actually 5-alpha reductase inhibitors. So they block some of the conversion, not all of it, but a percentage of the conversion of testosterone to DHT. Why would you want to do that? So the primary reason would be to shrink the prostate. So if someone has benign prostatic hyperplasia, if you reduce DHT levels, the prostate can stop from growing and even reduce in size and give some relief to people with BPH, especially if they're having urinary retention and they can't go to the bathroom. Some people also use a drug called Propecia, which is also finasteride, which reduces DHT levels that can potentially slow down androgenic alopecia, so men losing their hair. Okay, aromatase enzyme, we don't need to talk about that in males. We talked about that in females. So for fertility, so you can also give a male Clomid. We talked about Clomid in females. It's or clomiphenes, the generic name, is a selective estrogen receptor modulator, or a SERM. This will also block estrogen receptors on the anterior pituitary, okay, which inhibits the negative feedback of estrogen on the pituitary. So even in men, estrogen levels can cause negative feedback, just like high levels of testosterone will cause negative feedback on FSH and LH. So if we block those, we can have increased levels of FSH and LH, especially FSH, and really increase sperm production. So if a male's low sperm count, giving them clomiphene can increase sperm production. Also LH, so remember HCG, we talked about human chorionic gonadotropin in females. It's made by the placenta in females, and it maintains the corpus luteum. So the corpus luteum keeps producing progesterone to maintain the stratum functionalis of the endometrium, to maintain a pregnancy. Well, we can use HCG in a man as well, inject into a man, and it's going to be luteinizing hormone mimetic or mimic, right? So it's going to have the same effect as LH, and it's going to stimulate Leydig cells to make testosterone. So these drugs can be used in men and women. And lastly, we see the kidney there with the adrenal gland on top. So the adrenal cortex, there's three layers: the zona glomerulosa, zona fasciculata, zona reticularis. So the reticularis, the inner layer of the cortex, produces sex hormones. There's a couple of them. The main one is DHEA, or dihydroepiandrosterone. You can actually take this as an over-the-counter supplement, and this can be converted into estrogen, and it can also be converted into other types of male-type hormones. Okay, females are going to rely on this more than males.